All right, let's ask a fundamental question. When we look at recreational water facility management, does one size fit all? Walk up to a random stranger, offer to trade them shoes. Just a random stranger off the street. I don't know, guys, it may not work, at the mixers tonight to walk up to one of the pretty women and do it, but are you able to just automatically change shoes with anybody? Can you walk up to somebody and change glasses? Do all facilities have the same microorganisms? Can you control every microorganism with the exact same management strategy? Are the patrons in your zero-depth splash pad the identical biologically to the patrons in your 82-degree aqua size therapy class, and they're all geriatrics? Does a lap pool have the same potential for outbreaks as a splash pad, the spa? Obviously, all of these conditions are totally separate. And so in the past, we have looked at the control of recreational water illness using a one-size-fits-all. A pool is a pool is a pool. A spa is a spa is a spa. Is that the most appropriate way to manage some of these recreational water illnesses? Perhaps, but perhaps not. All right. If we're going to look at a recreational water illness management program, a risk base, what steps would we go through? All right. Textbooks are going to say, identify, characterize, and assess the health threat from various agents. Assess the vulnerability of specific health threats. Determine the risk, the expected consequence. Identify ways to reduce those risks and prioritize risk reduction. And if that sounds like it's right out of a textbook, yeah, that's exactly what I did. I copied it right out of a risk management textbook. And it's jargon. What does it mean to us as facility managers? That's what we'll talk about. How to make this work to your particular facilities. Look at any risk management from the industrial health side, and you're going to see an equation, something similar to this. Risk is a combination of factors that are put together. One of them is the hazard. One of them is the dose response, and one of them is the exposure. If you want to eliminate risk, if you make any one of those factors go to zero, and since they multiply together, your risk goes to zero. So we can use this type of equation and look at recreational water illness and see what we can manage, what we can't manage, and then identify where we can make that risk go to zero in your individual facility.